Hi, everyone. My name is Blake Cadwell. I'm the co-founder at Soundly.com, and today I'm joined by Dr. Amy Sarow, and we're going to talk about how to read an audiogram. So if you go to a local clinic and you take a hearing test, you have a whole battery of tests run on your hearing health in your ears, including a tympanogram. You might have a bone conduction test. You might have a speech test. But today we're really going to focus on the hearing chart portion of a hearing test. How do you read that hearing chart?
If we look at an audiogram, at the top left corner where we start up the frequencies, that's going to be low frequencies over to the left. And as we move over to the right side, that will be higher frequencies. So low frequency, think tuba or Barry White. And then high frequency, think like birds or flutes. Those high-pitched sounds there on that side. Then if we go down on the side of the graph there, we're going to have really soft sounds at the top. And then as we move progressively further down, it'll be louder and louder sounds.
Yeah, so as you're looking at a hearing test, in my particular case, I have a cookie bite hearing loss. So to give a real world example of this, my low frequencies, the tuba or the Barry White is pretty good. And my high frequencies, the flute or the bird is also pretty good. But then in the middle, mine kind of goes down. And this is why a hearing test is so important, because everyone's shape is just a little bit different. So I guess once you have this information from this chart, can you talk to us about how an audiologist would use the information? Of course, we have a screener on Soundly.com. It is a screener only and meant to just give you a sense for your hearing loss. But if you took a hearing test in a clinic, how would that information then be used to treat your hearing loss?
Looking at the hearing test, the professional can go over that with you and explain, what that means in your situation, in terms of counseling, in terms of, potentially validating some of your concerns and say, oh, you're having difficulty in background noise. Well, let's talk about why. And we can also talk about recommendations for your specific situation. So if you have good low frequency hearing, we would make one recommendation versus somebody who has, let's say, a flat moderate or a flat severe loss. That's going to be a different recommendation.
Think about this chart. There are some patterns. Folks will often fall into these kind of groupings or patterns. I mentioned a cookie bite, which is my hearing loss. But can you talk to us about some of the most common patterns that folks might be seeing on their hearing chart?
One of the most common types is called a sloping pattern, where you'll see the person has low frequency hearing in the normal range, or they hear better in the low frequencies, and then it will slope down as we go higher in frequency. So that person has trouble hearing the consonant sounds, hearing those bird sounds also. Then there's a notching hearing loss, which has normal low frequency hearing. Then there's a dip kind of in the middle or towards the upper end, and then it comes back up at the highest frequencies. And then we have a reverse slope. So this is where the person has more hearing loss in the low frequencies, and then it improves as we go up. So they have trouble hearing low frequencies, but they're easier. It's easier for them to hear the high frequency sounds. Then we already talked about the cookie bite hearing loss, where you have that piece in the middle that goes down. So we have more hearing loss in the mid frequencies, but better hearing in the low and high frequencies. And then we have a unilateral hearing loss, which means hearing is normal on one side, but we have some degree of hearing loss on the other side. And then we have an asymmetric pattern, which means we have both ears have some hearing loss, but one ear has more hearing loss than the other.
So if you're looking at a hearing test for the first time, especially if you've taken it online and maybe didn't talk to a professional first, it's a lot to take in, a lot to consider. But hopefully this gives you some sense for what type of hearing loss you might have, and a place to start in your research. Here on Soundly.com, we have various articles about each of these different types of hearing loss and more information on various types of hearing loss. But it's important to note that an audiologist or a doctor can be really helpful in the specific treatment of your particular hearing loss. If you take away one thing from this video, it should be that every hearing loss is quite a bit different. There are patterns that emerge, but the severity and the steepness of a slope can change by each and every individual. And so that's where working with a professional to get a prescription device that's customized to your hearing loss can be really beneficial to so many people. So Dr. Amy, thank you for your time and explaining this information. And to you, the viewer, we wish you the best in your research.